Okay, good evening everybody and welcome to everybody who has joined us tonight. My name's Hayley Clark. I am the chair of the communications group for the Society of Sports Therapists. And I'd just like to say that we are extremely excited for you all to join us for our first webinar of our 2021 series. And it's just to say that we've had a very, very strong level of interest here. Everybody, welcome to everybody who has joined us tonight. My name's Hayley Clark. I'm the chair of the communications group for the Society of Sports Therapists. And I'd just like to say that we are extremely excited. Sorry about that, everyone. A bit of a technical issue there. So as I was saying, we have had a really good level of interest in this webinar, and we really hope that you enjoy the session. So it's on the role of strength and conditioning in rehabilitation and sports therapy. So we've got quite a few bits and bobs to talk through. We've got some excellent speakers. But just a few bits of housekeeping to start with. So as I said, due to the level of interest, some of you will be joining us via Zoom. And some of you will be joining us via our live stream on YouTube. So just to say, the chat function is available for you to use on Zoom, and you can use the comments function on YouTube, but both are being monitored, so you can pose questions on there throughout. Unfortunately, just due to the simple time frame of the hour we've got, we might not get through all of your questions, but what we will do after, we'll pull together a sort of Q&A, and then we'll send that out to you all afterwards. Also, following the session, you will receive an email just requesting for your feedback. And once you complete the questionnaire, you'll be able to obtain your attendance certificate for this evening, and you can save and print that for your CPD portfolios. And then just one more thing before I start the introductions. We have actually also confirmed the date for our next webinar. So on Wednesday, the 21st of April at 7 p.m. again, we'll be delivering a session on the role of nutrition in injury rehabilitation and recovery. And we've got some fantastic speakers lined up for that one as well. So more details will come out in sort of future weeks, and just keep an eye on your emails and our social media channels, and you'll find out some more information there. And now what I'm going to do is I'm very pleased to be introducing Jen Wilson, who is the Programme Lead for Sports Therapy and Rehab course at the University of Derby. And Jen is also the Secretary for the Communications Group. So Jen will be chairing the remainder of this session this evening, and she'll be introducing you now to our fantastic panel of guest speakers. So once again, just thank you all for joining us. It is very much appreciated. We really hope you enjoy the evening. And I'll just hand over to you now, Jen.
Thanks so much, Hayley. And again, just to reiterate, we're really pleased to have you all here with us. I think this is quite a pertinent topic, particularly for those who are working in elite sport, but also for those who work with recreational athletes and your general population. So what I'll do is I'll go around the panel and let them introduce themselves. So if we can start with Robert Walsh.
Hi guys, I'm Rob Walsh. I'm the head of physical performance for the Dutch Olympic snowboard and ski program, and also do some work with the sprint program in athletics and skeleton bob. And so I've got a background in sports therapy, sports rehab, and also was the head of performance at Harrow School before I moved to the Netherlands, and was a senior lecturer and program director of sports rehab at Middlesex University before this.
Thanks, Rob. And if we move over to Luke.
Hi, good evening. Luke Jenkinson, Head of Performance at Derby County Football Club, currently completing a doctorate in the role of isometric training in team dynamics sports. Also Associate Lecturer in Strength and Conditioning at the University of Derby. Again, primarily a strength and conditioning coach that has worked off-field mainly. So my main interests have been around strength in a gym-based and rehabilitation.
Thank you, Luke. And if we move on to Josh.
Hi, my name is Josh. I'm an associate lecturer with Jen at the University of Derby. I'm also completing my PhD there, and I'm also the S&C coach for Burton Albion ladies first team and the lead physical development coach for Derby County's RTC, so they're young girls.
Thanks, Josh. And if we move on to Damian.
Yes, good evening. My name's Damian Harper. I'm a lecturer in coaching performance at the Institute of Coaching Performance at UCLan. I'm just completed a PhD examining deceleration in team sport athletes, and I also work in football in support of England girls talent football. I've been able to consult during my PhD on development breaking strength in international football players and numerous sporting organisations as well.
Thanks, Damian. And then finally, John.
Yeah, hi folks. Thanks for the invitation, Jen. John Kiley, nice to meet you all. I work in the University of Central Lancashire primarily as a supervisor for people doing professional doctorates or PhDs, all practitioners out in the field. Other than that, I've been around the block a couple of times in elite sport, so hopefully I can contribute something tonight.
Brilliant, thanks, John. So the reason we've come to the panel we've got is because there's a nice mix of people who are involved in strength and conditioning, but also have been involved in some capacity in rehabilitation. So, for example, Rob spans both realms in the sense that he is a qualified rehabber and strength and conditioning coach. So we'll be drawing on those experiences as we're going, I guess. But what we're going to start looking at is the role of strength and conditioning in sport and exercise therapy practice and rehabilitation practice. And what I really wanted to draw out from this discussion is the fact that strength and conditioning isn't just something for the elite. So if we can go to Luke first, I suppose there has been very much a general focus on strength and conditioning being something that only the elite access. And I think, if you think strength and conditioning, what comes to mind is a nice facility, barbells, etc. But I know you use the key principles of strength and conditioning with your sort of age group athletes. I know yourself and Josh have used it with sort of recreational level athletes. So I wondered if you think, has this impacted, or has the role of, has strength and conditioning impacted the injury rates in your players and individuals? And do you consider your athletes to be more robust as a result?
I think, of course, we've seen that with the athletes that I've worked with, so spanning from the age of 9 all the way through to senior international level athletes, when we talk about that rehabilitation process, if you come into an environment, this formal professional environment, then of course there's potentially all this is going to mean is resources and equipment. But as you alluded to there, Jen, the underlying principles and themes of what we're trying to achieve and where we're getting to is to shall we say, best equip the athlete to return back to practice or performance, whatever that looks like. So what we're looking to do is to leave that process and enter that journey and go through the systematic stages with confidence that they're going to not regress, and for us to develop our athletic abilities and moving through those stages of rehabilitation. Now, if we're talking about medium to long term, and we're talking about youth athletes, of course, we have the challenges there of maturation through that stage as well, and what the impacts of, even if we talk about reconditioning, looking at energy system development or going through periods of increased growth. But if we talk about looking at specific strength metrics between returning back to training with this real high level elite players, and we're talking about using isokinetic dynamometry or force platform work, yes, we'll start to get some of these objective numbers, but the principles of, let's say, jumping and landing, absorbing force, using entry and exit criteria through these stages from early stage after acute treatment with the medical team, moving back to that returning to function and returning back to performance, those principles stay the same. And that can be as basic as counting jumps on and off a box, or running at different velocities, or covering a certain distance in a time. So it may be that we don't have a GPS unit, but we know if we're going to run 60 meters in 10 seconds at some point we're going to be covering circa 6 meters per second, for example. And this is stuff that we don't need in non or sub-elite environments. So potentially, if we think about this hierarchy, that these formal environments are going to start getting down to the real objective intricacies, but the general themes and principles are the same. And the question about whether we're actually impacting injury rates or return to or the performance levels post, I think that's a huge question that we could spend a hell of a lot of time discussing. But what I do think is, in the 11 years that I've been working in professional sport myself, is we're certainly in a better place and more equipped as a multidisciplinary team to address the requirements that are presenting to us. And I think that we're actually starting to, at least in the environments that I'm working at, if we think about doctor, physio, therapist, rehabilitator, conditioner, these lines are becoming blurred, and that we're starting to see people with more specific interests covering over, and actually where we fit in this fight, returning to performances, that it's not just a go on, you're taking stage 4, off you go, and that we can start all as this multidisciplinary team impacting that journey for our athletes.
Thanks, Luke. Yeah, I think it's an interesting point that you raised there, because again, there's perhaps a lean towards strength and conditioning being around strength training, but it's so much more than that, and that's perhaps the bits that we're not accessing in therapy practice at the minute. So, Josh, I wondered, you again work with a number of age group, but also I suppose they're not recreational athletes, but they're not elite athletes either. So yeah, same question, I guess. You know, do you consider your athletes to be more robust as an outline of practicing more strength and conditioning, or do more strength and conditioning? Because your practice is obviously slightly different to Luke's.
Yeah, I think if we're thinking about like some of the underpinning skills or qualities of an S&C coach, I think one of the things that doesn't get discussed enough is our role as a planner. So a big part of being an S&C coach is planning and then discussing with the MDT when it's perhaps appropriate to sequence certain training factors. When are we going to work on high intensity days? When is it going to be intensive? When is it going to be extensive? And I think you don't need to have a big budget or lots of equipment to have those sorts of discussions with your team or an athlete. So I think in terms of trying to contribute towards risk reduction, then just having somebody that's a competent planner and being able to competently plan training is really useful. And I think that certainly contributes towards making a more robust athlete. I also think, touching on sort of what Luke was alluding to as well, and is thinking about perhaps more from a movement perspective, how we can make athletes quite robust. And working with youth athletes, it's not necessarily about lots and lots of external load or lots and lots of just, meterage and things like that. Actually working on more like the motor control and the coordinative overload types of thinking, get a bit boshy with it sometimes where it's appropriate, but thinking about, how can we increase our athletes' capacity for movement? How can we make them be better able to cope with movement variability and things like that? For me, I think that is a measure of somebody being robust, because it's really difficult to say you've prevented injury or anything like that, isn't it? But I think as S&C coaches and therapists, it's easy to spot somebody who's a competent mover. And if we can do the sorts of activities that make somebody have a better movement literacy or movement vocabulary, whatever sort of buzzword we want to use, then I think that does contribute towards them being robust. I don't know if Luke agrees with that or...
I absolutely, completely agree. I think that, as we've alluded to so far, is that there's so many different factors and aspects of athleticism that we're looking to develop and manage. And as you rightly say, it's all down to this risk reduction or relative risk or performance enhancement. And I think that the more diverse that the opportunities that our athletes are exposed to, and the more movement preferences or movement capabilities that our athletes have to operate within these dynamic environments, gives them more options to excel within these environments.
Brilliant, thank you. And then Rob, so obviously you come at this from both a rehab perspective and a strength and conditioning perspective. Are there strength and conditioning principles you think we should integrate into clinical settings? And I guess as a follow-up question, do you think the strength and conditioning principles that we do have in therapeutic practice at the moment need revisions?
I think with my background coming from teaching as well, I when I graduated first, I felt that my technical skill in the gym, so what I was taught my undergrad was really good, came out clinically could diagnose, assess and treat, but actually the getting people back to participating to ADLs or high performance, I was lacking the programming skills to do that. And I think even when I was teaching for 15 years across sports therapy and sports rehab, that was one of the things we tried to get into the undergrad programs. And obviously it's hard because you have 3 years and it's something that takes a lot of time to get good at. But I think understanding programming better and where you're trying to get to and what maybe an elite athlete or someone who's physically active, where they're trying to get back to, and being able to program back from that. So one of the things that just kills me is when I see somebody come in with 3 sets of 15 across every movement pattern, and I add up the reps and sets and it's 450 repetitions on their shoulder because they injured their shoulder last week. Then I'm like, well, your overload's through the roof. So I think a better understanding of the and even in strength and conditioning, the principles of training, overload, and that cumulative load between physio and S&C. So one of the things I do is I sit and add the load up between physio, S&C, training load, and go, we're way over with that guy and bringing it down. And being more of a reductionist. So higher quality, better programming, and that the program is not about rehab, not about S&C, it's a performance plan. So if somebody becomes injured, you integrate the rehab into a performance plan so that they don't feel that they're injured. That's one of the big things. So the minute they get injured, you create a performance plan that clicks into, we didn't get to work on this or this while you were competing. We can now bring these factors in and make them better. So the athlete feels that they're always moving forward towards that end goal. And the same with, I think that crosses over into your everyday client, is it's not a rehab program. It's let's make you fitter, make you healthier. Let's look at what your lifestyle goals are, and that be the total package of your programming. And I think that's where you ultimately can be more successful, is by packaging that in. If I think for therapists, we need to be better at programming. And I think for strength and conditioning coaches, where I see we will fall down is understanding pathology. Why can't I do that at week 1? Why can't I do that at week 2? Well, there's a pathological reason. And that's where really good debate and really good teams can come together and put out that performance plan working backwards. Equally, if a physio signs somebody off, a power athlete, and the day before they go back competing, they're doing 3 sets of 15 and they're a power athlete and they've done that for the last 6 weeks, well, their sign-off's not going to be great. If their sport is jumping, landing in total chaos like snowboarding, and they've been in a totally controlled environment for 12 weeks, and then they go, yeah, you're good, and they're jumping 7 stories at 100 kilometers an hour in a completely uncontrolled environment, then they're probably not going to be fit to return. And then I also think we can creep more preventative stuff in through microdosing. So actually putting in very small amounts consistently of, like, you know, everybody does hamstring work, but is it just really light, superficial stuff? Right? Are you actually loading it? Are you loading at the velocities and intensities specific to that person? And have they built up to that specificity range and that load? And can you microdose that into a program so it doesn't need to be taken out and done as rehab? Can you fit it in through the program? So ultimately, I think as S&Cs, we need to be better and have a better understanding of injury management and pathology, which is great. We get that in those therapy degrees. And I think as therapists moving into that space or working within that space of S&C, we need to have a way better appreciation of load management and program design. And undergrads should be getting out and working in a gym from day one to learn and experience that and train themselves and feel what a strength program is like when you've done it for a good few weeks. And if you extend it beyond where you need an actual recovery or hypertrophy program, and experience that from the PT level right up to the high performance level. So I think that's kind of where, if I was back in my undergrad program, I would want to be working more in a gym, working more on that sort of stuff. And obviously, if I'm an S&C, I'd want to go, if I was doing an S&C degree, I'd want to be learning more about pathology so that I can communicate better with physios or sports therapists, whoever is there.
Yeah, I think there's some really good stuff coming out of that, and I guess from the same from Luke and Josh, in the sense that there needs to be this general approach to athlete or recreational athlete robustness, which we're going to get onto in a second. And it's almost like, you know, the therapists are really good at the bit that happens after the person gets injured. Your S&Cs see the person, before they get injured, but there's no marrying up in between. So that leads me really nicely onto Damian. So obviously, Damian, a lot of your work's been around deceleration, and that suggests to me what we're looking at is stress management. And I think one of my major concerns for our recreational athletes, and one of the potential reasons they sustain as many injuries as they do, is because they possibly don't have the tissue condition. So if I get someone who is sedentary through the day, they're not really active during the day, they're desk bound or whatever, and then they're undergoing a running program, for example, they may not have that tissue condition or capacity or ability to decelerate and manage force as our athletes do. So do you think S&C has a role in our sedentary or our recreational level athletes? And can you tell us a little bit more about your research and what that's led you to?
Yeah, cheers, Jen. I think obviously from the deceleration perspective, and just really touching on what Rob's just been talking about, really, that, you know, it's the end point that we're trying to prepare, you know, the recreational athlete or the elite athlete, we're trying to prepare them for the demands of what they're going to be exposed to. And I think for me, that's probably the most important starting point. And I think probably an area which we haven't got enough intelligence on at the minute, I don't think. You know, particularly from my research, that's something which has come across, you know, in terms of the understanding of deceleration and the demands that places on an athlete. We've tended to focus quite heavily on, you know, the opposite, you know, how to speed athletes up. We've increased the momentums without having too much focus on how they slow down them higher speeds. So I think, yeah, you know, the highest demands that they're going to experience, it tends to be in that the braking phase, whether that be on a step-by-step basis when we're looking at basic running programs, to, you know, change of direction mechanics and some of the, you know, the high intensity decelerations that players will be required to do during match play. So I think that, you know, for me, it's, you know, it's a really fundamental element. And to break that down, I think, as we've been touching on, it's not just a focus on, you know, specific exercise. It involves a blend of various exercise stimuli to be able to ensure that they're optimally prepared, both from the musculoskeletal perspective, but also, you know, that's blended in nicely with the coordinative work, you know, utilizing a mixed method approach. And I think that needs to be a central tenet as such throughout the program, throughout the periodization, that, you know, how can we blend the more generic traditional loading parameters with the coordinative elements. And I suppose that's where, you know, Rob's touched on the microdosing element, and we've mentioned already about, you know, pre-activation or preconditioning stimuli. And I think that's a really important part, because if we're clever in that prescription of these preconditioning and pre-activation strategies, then we can help to protect the athlete from those potential high intensity loads when we're looking at a preventative strategy. So that might just be microdosing some isometric or some eccentric, you know, contraction modes prior to them being exposed to, you know, an upgrade in high intensity movements. So I think, you know, definitely from a recreational to an elite perspective, it's got to start from understanding the demands that they're going to be exposed to. And I would say we probably tend to try and think too much about preparing them for the worst case demands of the match, instead of preparing them for in excess of that. You know, that should be the target, I think, you know, preparing them for the, you know, in excess of the match demands that they're going to be experiencing, you know, in worst case scenarios.
Yeah, I think that's a really great point, Damian. And I think, you know, if we look at a return to running program, and again, Rob might want to jump in here, we have a very sort of set of standardized programs for returning someone to running in therapy, but obviously that doesn't necessarily consider things like tissue condition, preparedness for return to high load activity, which of course running can be. You know, not everyone, even if they're road running, it's not necessarily going to be a straight line over an even surface. So there's lots of things to maybe take into account that should factor in sort of a later stage, return to sport stage of rehabilitation that we potentially don't touch on. And I realise that I'm domineering this conversation about running, so I'm sorry, I'll try and move away from that if I can. But I don't know if you have anything to add to that, Rob.
Yeah, just what Damian talks about. I mean, my sport is, everybody thinks it's jumping, but it's not. You don't get any points for jumping. You only get points for landing. So it's completely force reduction is the actual big thing with us. And the guys are dropping a huge distance. So we train for worst case scenario, because if it is a worst case scenario, we don't get a little hammy tear. We get an air ambulance and hospital visit. You know, it's pretty major for those guys. So I think that's definitely something that you look at, is what are you conditioning back for? So does your you know, closed, I'm generalizing because not all of it's like this, but is it a very closed physio environment, and are you signing them off back into something like that? So we do super maximal eccentric work with our guys on a K-box, which is way more force than they will probably see if they land badly. And then also one of the other things we look at is cumulative load. So, you know, one of the first texts I had was bringing in analysis software to look at cumulative load and what they're doing. So is our training matching what they're doing on snow? If they do, you know, if the snow condition's really good, are they going to do 2 big days and a rest day? No, they're not. They're going to do 5 days of massive jumping when the weather's good. So how do you manage that, and how do you manage that? So for me, a lot of the time, and even when I work in athletics or in skeleton bob, it's looking at the different athletes you have in front of you, and where do you take S&C out to give them the ability to do their sport more. So ultimately our goal is to make them more available to participate and learn their skill, because doing skill work in a gym is not as good as doing skill work on the pitch. No one can argue. The specificity is highest on the pitch and what they're doing. So we want them to be available, fit, and that they don't break down. And in a high cost sport like skiing or snowboarding, that on snow training is super expensive. So that's one of the things we use with data capture is how fit is this athlete? How many high speed runs can they do in skiing? If they're getting 5 and the coach wants 10, the cost per run is even higher. And that sounds dreadful, but we want to get them conditioned enough that they get as many experiences to be better at their sport as they can. And that's ultimately what I think physio, S&C, therapy want, is the athlete out doing their sport, not with us. The same example with maybe say some of our skeleton bob or athletics athletes is less is more. You know, pulling out sessions to allow the training to give them the impulse that they need or the stimulus, and then only putting in enough the minimum effective dose to keep them going at the highest level. We sometimes with better athletes try to do more and more, and actually that are we the limiting factor in their performance. So I've become a real reductionist in terms of programming and therapy, even clinically, since working at a more high level, and I'm getting more and more so that less is more, but higher quality of what you do.
Thanks, Rob. That actually segues us really nicely into John. So John, you wrote a seminal piece on called The Robust Running Ape, and that for me really is a bit of a missing link in terms of injury prevention. Because what we're all saying is we ultimately want our athletes to be more robust, and actually how we get there is making them move better. That effectively will, as Rob said, will reduce the likelihood of them breaking down. So I just wondered, John, how do you think strength and conditioning can make someone more robust? I think you're on mute.
I did a guest lecture for a big university a few weeks ago, and I talked for an hour on mute. If that's possible to talk on mute. I wanted to dive straight in with something interesting, so I just ignored everything, and yeah, there you go. Anyway, yeah, I'll have to give me the question again, Jen.
Yeah, so how do you think strength and conditioning can make someone more robust?
Yeah, okay, so strength and conditioning doesn't. Smart training does. Smart rest does. From a running perspective, yeah, I mean, I guess all I can do is really synopsize the basics that everyone knows. It's got something to do with tissue durability for sure. I mean, it's got a whole lot to do with how well you can coordinate those tissues. And it also has a lot to do, and it's something that hasn't been mentioned but is crucially important. It has to do with the athlete's belief, the athlete's sense of meaning, what running means to them, their confidence in their ability to run, their anxiety coming up to a race, all those type of things through very direct mechanisms screw with your ability to coordinate. If your ability to coordinate is off, then tissues start getting loaded in a way that is suboptimal. And you do that for long enough and you're going to start, something is going to start getting sore or start pinging. You're going to adapt. Loads are going to be transferred to other places that maybe aren't used to those loads, and you're going to end up in a vicious cycle with an overuse injury.
Can I pick on that then? Because sort of our next topic area is reconditioning the athlete, and obviously you've had quite an interesting career journey in what you've done with the Irish RFU. So you were actually working with them in season. I know we've had conversations about what your role is, and I think one of the things that struck me is you were there as someone who would support strength and conditioning rehab, but your role was you were doing lots of different things within that role. So can you just explain how your work as a coach fitted within the in-season, and I suppose, was it more than just strength and conditioning? How did you work with those athletes?
Well, I guess for the bones of 20 years, I've been working with athletes who are either injured or perennially injured or trying to squeeze out one more competition, one more Olympics, one more World Cup. And so I think a lot of the things that have been said already, although very sensible, are from different contexts. In a context where you're working with a rugby player who's getting severe pain, all the time, and you need to give them enough to get selected on, at the weekend. It's a very different scenario than you're trying to foster and nurture a young talent. So I think there's a lot more awareness of the role of pain and those type of alarm systems that athletes have. And a lot of training and training design is to kind of take away some of those fears and anxieties, because they're the things that amplify pain, amplify negative emotion, cause people anxiety, cause people to perform badly. So if I could kind of scroll back, when you're working in those, let's call them time pressured scenarios, principles of good programming, I don't even know what that means in that context, because you don't get to program. The head coach gets to program. You're trying to fit 5 minutes in here, 10 minutes in here, dotted around the week or around the day. And you're trying to think, the problem is, how can I get, if I have small slots and I don't want to take away too much energy and I don't want to impose any fatigue that's going to have a knock-on effect in the next session, what can I do? And I guess the three kind of legs of the stool for me are, okay, I can drive positive remodeling at the level of the tissue pretty easily and safely. Isometric, partially eccentric movements, could be a lot of time I'd use manual movements, so I'd be the resistance or I dictate the speed. I can enhance coordination in a way that is non-fatiguing, so could be a stability challenge, stability with a task, anything that causes the athlete to pay close attention to the sensory feedback they're getting and turn around an appropriate movement action. And the last kind of leg of that stool then would be, I need to enhance the athlete's sense of competence and confidence. And that's all about setting challenges that they can achieve, and then them being able to make the link between, I got better today, I made a little bit of progress today. And I think we completely undervalue how important that is to athletes, how important it is that they go to bed at night and they're not stressed about a pain or an injury or a diagnosis. We are universally brutal in our world at talking to athletes about diagnosis. I'm blue in the face from sitting in meetings where someone picks up a scan and everyone goes, you know, bad practice. We need to be not misleading people, but giving them some sense of confidence. We need to be realistic, but give them some sense of control.
I think that's a really nice point, and I think it's interesting because we have a real issue with terminology use. If you take something like weak glutes, for example, and someone will hang on to that as a term, and that is saw that eye roll, Rob, that is a thing they become then, isn't it? And I think, you know, our role as therapists and as strength and conditioning coaches isn't just to manage the injury, but manage the person and approach it from more of, I guess, a biopsychosocial model. Thanks very much for that, John. So with that then, again, just from your perspective, Damian, and again, I go back to some of the papers that you've released and the work you've been doing. Why do you think strength and conditioning is particularly impactful to reconditioning the athlete if they're recovering from injury?
Again, it's probably just filtering in some of the principles that we've been talking about, really, in terms of confidence, as John's just been alluding to. You know, I think that's a massive element. Again, that they're not going to move efficiently if they have got any element of threat, in their movement. So that's a key part of the reconditioning process, to ensure that the athlete is there's no threat there for in terms of the movements that they're going to perform, because that's again going to affect the effectiveness of the stimuli. So I think again, coming into that reconditioning element, it comes back again to, for me, the fundamentals. Can they attenuate forces? That's really critical. And can we develop the ability of the muscle tendon unit to work efficiently? In terms of maximizing the elastic components. I think that's really, really, really key. Because if we can do that, we can make their movements more economical, and that's a win-win situation in terms of a fatigue impact as well. So it comes back again to the eccentric element and the ability to control forces. If we can get them to do that, and they can capitalize on the elastic structures, then it links to that movement economy and movement efficiency. And reductions in load, during later stages of the rehab process. But yeah, particularly for the decelerations, they have got to have the tendons is something which we often too much focus on muscle, and what are the effective stimuli for tendon and elastic components. How can we adapt those efficiently by utilizing stimuli which is more effective for those tissues. That's where isometrics and some of the stuff Luke's probably doing in that field is really powerful, I think, from that perspective, and really important for deceleration, because the tendon and the elastic tissues provide an important buffering mechanism as well. So that's really important for reducing muscle damage.
Thanks, Damian. I suppose this next question goes out to yourself, Luke and John. So you mentioned there, Damian, about the impact of people not wanting to load damaged tissues. And I guess we know the relationship between pain and fear of pain. How do you manage that in strength and conditioning practice? If you've got an athlete who you're working with to get them back out on the pitch or whatever it is, and you find that they're not either not performing because they don't want to do a movement, or they don't feel like they can do a movement, how do you approach that in practice?
For me, it comes down to this systematic approach and understanding what are we've got to have a relationship with our athlete. We've got to give that as a given. We need to delve deeper for where that hesitation is coming from. Is it previous injury? Is it previous rehabilitation? Is it previous experiences with a performance department? But if we sort of park that to one side and start to look at ways of, as a practitioner, increasing our confidence, and what Rob spoke about all the way at the start. So talking about a type of programming and moving through stages of programming, moving through as the athlete moves to the next element of their rehabilitation, we should have had confidence from a practitioner sense, but also transferred why that gives us confidence for our athlete to move to the next stage. And that may mean that we talk about, let's go an arbitrary anterior ankle injury, and actually cutting to the left is creating issues. So if we go back to our principles of programming, let's do that really slowly. Let's not do many of them. Let's do that in a really controlled environment. Let's now start to increase the volume of that we do. Then we start to increase the intensity that we're doing. Now, can we do that to a level that we would be expected to do for a free movement? Can we now start using external stimuli to then create a more of a cognitive challenge and from a coordinative perspective? Can we then actually start making that more sport specific and starting very general and moving through our dynamic correspondence and getting closer and closer to the end game? And through that controlled and coordinated, as Josh said, programmer and planning, the aim is that the athlete shouldn't be, or there is an overload that they're not conditioned to do that's outside of the zone that we would deem acceptable. And when I say we, that can be objective, subjective. But yeah, I don't know. Sorry, John.
Do you have anything to add to that, John? So how do you manage those athletes in practice? What does it look like?
To me, it looks like whatever the situation demands. So I don't have a formula. I have, principles I work to, but I don't have a formula. And because a lot of the folks I would work with have had multiple serial injuries or perennially injured or under severe time pressure, it's not appropriate to transpose a plan from here, well, this is an exercise I like, or this is a plan that I think worked the last time. That doesn't happen. Everything is, okay, this is a novel context and I need to come up with a novel solution. Sorry, not I. We, me and you, the athlete, need to come up with a novel solution. The basics are you find a jumping in point. And it doesn't matter if the injury happened yesterday, the injury happened 6 months ago. What's the jumping in point? What can you handle? Okay, let's start there. How much time have we got? Okay, let's expand it. And it's constant dialogue. And that was my comment about planning and programming. That's way too inefficient in these contexts. I'm not saying in other people's contexts, but it doesn't work. It's dialogue. It's, okay, we're going to load the hell out of that today. You might be really sore, but you know what? You're a big girl. You're a big boy. You're a professional athlete. You want to play in 2 weeks' time. We need to get through it. So there's some of that, and a lot of it is seat of the pants. But I think it comes through honest dialogue with the athlete and coach, and physio and whoever else is involved. But normally under these situations, professional athletes want to work. They don't want to sit at home thinking about it.
Yeah.
So in a sense, you give them work, but you try and make that work as appropriate as possible.
And through that period, John, we can spend so much of our time doing the bits that we can do and the elements that we can still develop that is interspersed with the area or the subject that we're working on with our athlete. Yeah,
no, absolutely. And I think it's very important to do that. And I think you might have mentioned it at the start. It's giving the athlete the sense that, okay, my career has been put on hold, but I can do these add-ons that will address this deficit that I've had for ages. So you're doing extra work. Yeah, absolutely.
think that, you know, we could discuss how you approach working with an athlete in terms of making it a positive experience. And so we could be here for hours, couldn't we? But I think that's a really, really nice point. If you spin it, so it's now we're going to work on the stuff that we don't have chance to do, and you're probably going to come back stronger. That's a really nice point, isn't it?
Well, I think
sorry.
I was just going to say, before it goes out of my head, I think there's necessity to be brutally honest. And if these are, you know, senior players, senior athletes, that's okay. That's what they like. And it's, you know, it could be, forget about the pain. You're always going to have pain there. Your knee is screwed up, but that doesn't mean you can't perform. I think a lot of the time in rehab, we're under the illusion that we can completely scrub away all pain. And in a lot of contexts, you can't. But you face up to it and say, you know what, maybe we can reduce it, maybe not, but it's not important. But it's so often we amplify the relevance of pain in the athlete's head, and it's like everything is scary, everything is hands off, and it's what I think of as a nocebo effect. You know, the placebo's evil twin. And you look at the research on placebos, and the nocebo effects are 6 times more powerful than placebo. You give someone a positive suggestion, maybe they get 10% better. You give them a negative suggestion, boom, and they go off a cliff. And there has been some recent research in using coaches, and even facial expressions impede athletes' performance. So I think, you know, we can talk all we want about loading tissue and coordination and so on, but there's something that we can all definitely improve, you know, culturally. And that's how we present to athletes, how we talk to athletes, how we can be very realistically honest with athletes, and I think they'll respond to that.
Thank you. So I'm a little bit conscious of time, so I'm just going to move on to Rob and Josh to finish. And I suppose I might be a bit controversial here. I think as strength and conditioning coaches and exercise, people who work in exercise prescription, we're very much taught you will get X outcome from doing X amount of sets and reps. But in my head, sport turns that on its head a little bit. So a conversation Rob and I had yesterday in terms of reconditioning an athlete, preparing them to go back to play, was about how you load them. And I know, Rob, you touched upon using high loads but high quality earlier in measuring volume. So the question goes out to both you and Josh. For you, Rob, what are your thoughts on high loads during the later stages of rehab? And then Josh, do you think the sort of therapeutic community need to adopt more load quantification strategies? So if we start with Rob. You're still on mute, Rob.
Back? Can you hear me?
You're good.
Yeah. I just hark back to what John said, in that it is contextual in how you place it with the athlete. I think that's one of the biggest things. I would totally agree that I've had athletes just go, oh, this injury. And I think that's where what can you keep doing that feels and looks like what they were doing before, that's at a high level, even if they're injured and they're in pain. So I think I have a couple that are injured at the moment, and the minute we got them back, somebody can't use their leg. Well, we've got one that has an interosseous sprain at the moment, which it's in the media, so I can talk about it. And some of his training's online. We've already started with maximal leg strength on one side, quad and hamstring work where the vertical compression is not in that injury. So he was pretty panicked about it. The whole program was, but actually you're maintaining and developing, and he can still see it's similar to what he was doing. So that peak makes people much more relaxed and athletes much more relaxed. So I think, what can we do that's performance enhancing now? What can we keep going that's performance enhancing? And are we building the program back? Like, are we taking everything back down to 5 sets of 10 and making it super easy? What can they do within the realms of possibility? And I know what John said about sometimes you fly by the seat of your pants. Well, pathology is pathology, but someone's reaction to it is shifting left and right. And each day you've got to adjust that program to that person and the outcome that you're looking at. So it's a sliding scale of I can remember in the old books back in the 90s when I studied, they had clear day-by-day guidelines. And then those were taken out, because if you're just following the guidelines, somebody could be 4 steps, 5 steps ahead. So you have to react to the athlete in front of you and have an overall plan. But I've got strength work on in there now. Is it going to injure the athlete or cause harm? Yes or no. If it's a yes, then you don't do it. Is it going to enhance performance? So those are the things you need to kind of look at, I think, in terms of what you do early and what you do late. And is there a gradual? So when we build our rehab programs, we look at what the doctor says, because they oversee it, what the potential time frame is, and do a worst case scenario back. And then that's a draft. And then we work on it, and each week and each day review it and go, where are we at now? Can we move forward a bit more? How reactive was that situation? Was it good or bad? Can we make another step forward? Can we make another step forward? And that way the athlete has an overall picture, but then has a constantly shifting forward program that's related to them and is done with them. You know, and equally to do with injury, if you've got a major competition coming up, if you ask this when you're teaching, some people will say, no, they can't do this because the healing quality is that. Is that athlete ready? What's the risk of them getting re-injured? What is their personal decision? And I think that's a pretty interesting ethical debate around it as well. But I think overall our programming needs to shift to be more performance orientated while during rehab, maintaining and developing what we can, and being liquid that we respond to the athlete in front of us and the situation. I'm lucky when I used to work in rugby at a similar situation to John, that you're trying to squeeze stuff in. If we've got an injured athlete in what I do in snow sports, we have a pretty big off season, or they're back with us in a flat country with no snow. So I have them all day. But if I have them all day, I don't want to bore them to tears and make them hate the world because they're stuck in the gym or they're stuck in a rehab center. So we need to make and create an environment where they can do as much as they can that's positive.
Thanks, Rob. And then finally, Josh, I think you're a bit of a guru on load quantification. So do you think that's something we maybe need to adopt in therapeutic practice?
I think it's definitely useful, and perhaps having a really decent understanding of load from more than just an external load point of view, and some of the stuff like what John and Robert are both talking about in terms of like that biopsychosocial appreciation of someone's readiness to return. So I think, and another thing, working with young people, what you think their load is and what their load actually is massively different, because obviously they're not full-time athletes, and we might not be in fully control of their training. And you start to have these conversations around injuries, and then it turns out, oh, they're playing 3 other sports and they do PE for 2 hours before they sit in a car for 2 hours to come to you, and you're just like, oh, okay. So I think that's one thing, is really trying to understand what your typical load for your athlete is when they're young. And like, I can't remember who it was who was saying earlier, that sometimes a good S&C coach or a good therapist, it's about what you can take away as well as what you can add to try and optimize the process. And I think that's an important part of load management. But in terms of thinking about it from what can therapists take away, I think one thing that S&C coaches probably are good at is the whole needs analysis part, is understanding what the demands of a sport are. And I think in a multidisciplinary team, the meaningful conversations between the therapist and the S&C are talking about what are the demands of the sport, and then what can we use as a measure of readiness? Because if we understand what it is that they're going to be exposed to, then we can facilitate that nice gradual return. And it's not necessarily can we have 1 billion metrics, because we can literally have 1,000 metrics just off a jump. And is that useful? Probably not. But if we've got some kind of measure of capacity, some kind of measure of workload, and we can gradually reintroduce that, then that gives us the physical confidence in the, tissue tolerance and things like that. But then also when we're talking about instilling confidence in the actual athlete themselves, well, if they're seeing that graduated return and they're seeing these typical metrics that they're used to discussing with coaches and making this return to where they were, then I think that's perhaps one avenue by which you can instill confidence in an athlete.
That's brilliant. Thank you, Josh. So I'm well aware of time, and I think we're now going to head back to Hayley for some questions.
Thank you, everyone. That was really some great discussion going on there. So we have had a few questions. So I'm just going to sort of pick some of the ones that I think are quite relative, and you might have some good discussion on. So there's one here with regards to, is there a particular stage of rehabilitation where you would begin to implement strength and conditioning training?
I think based on what we've had the discussion about today, and I can see Rob getting ready to jump in here, it's from the get-go.
Say day one. Yeah.
Yeah, my biggest pet peeve is just not starting on day one. Like, it depends on the psychology of the athlete. Some athletes, need some downtime after an injury, and I think you need to look at it on case by case basis. Others just lose their mind and want to be back at it on day one. So you really need to, as John said, factor in that personal side of it, but you can get stuff done from day one. So for me, the day they're injured, you have a phone call. If they're flying back, what is it? What's the severity of it? And that there's already a plan formulating. So that for us, the athlete's flown back. So as they're getting back, those conversations are happening. They feel that the ball is rolling, and you can get doing the stuff that you want to do. And equally, if that person needs some downtime, that you factor that in and you give them that. So it's that athlete-centered program that's supported by the whole team, and the plan comes out of that.
Yeah.
That's great, thank you. And then we have another question with regards to female athletes. And do you program S&C around menstrual cycles in female athletes?
I think this is a really interesting question, and my understanding of the response, the hormonal response, is the science isn't there. We have some understanding of what happens. Thanks, Josh. We have some understanding of what happens during the menstrual cycle and the potential impact it can have. And yes, as with all of this, every individual athlete is going to respond individually. So it's worth knowing who your athlete is and getting an understanding of that. But it shouldn't make a difference to how you program for them. See, John's got his hand up there.
I'll tell you what it does depend on. It depends on the athlete's belief.
Mm-hmm.
If that female believes, I need to plan, I need to program around this, then it definitely is important, and you need to pay attention to it. And some do, some don't, some care, some don't, so, but again, yeah, belief is an important thing. It's not about us sitting there with our beautiful Excel sheets, doing our little sums with our calculator. It's what's much more important is what we do aligning with the athlete's beliefs, and where the athlete's beliefs aren't appropriate, how can we meet them and start to change those or morph those to a more positive set of beliefs.
I suppose Josh works with age group athletes, so he might have an age group female athlete, so might have something jumping on that.
Yeah, I mean, I'm working with obviously a first team of all adult female athletes as well. One thing I would say, a therapist or S&C coach, it's really important to have these conversations with your athletes. You need to not be scared or taboo of talking to women about the menstrual cycle and their perception of whether or not it's influenced in training. Because like John said, the perception of it having an influence is as good as it having an influence. And I think it's really important to start that dialogue and talk, because like Jen said, the research isn't there. But you can either take that as we shouldn't think about it, or perhaps it's approach it on a very individual basis, on a case-by-case basis. And I think that's certainly what I try and do with my ladies team as well, is start that dialogue, have that conversation. If it can be inbuilt into some kind of your monitoring, then that might be useful. And it might be retroactively you see some links, or you see some things, because again, we can talk about theory and what works for everybody, but as a practitioner, I care what works for my team. And if something works for my team and a metric is telling me something, then I'm probably going to work with that rather than what a group of journals says or doesn't say.
There's one other thought in that, and I agree with what Josh said there. But the other thing is, if you are a female athlete, some days you are like all of us, you're going to have to compete in a bad day, a really bad day. You feel sick, you're wherever you are in your menstrual cycle. You're coming back from an injury, you wake up after no sleep, you had a row with your boyfriend, girlfriend. We have to help athletes be robust to that and just be able to wake up and go, yeah, you know what, it's going to be a shit day, but it doesn't matter because I'm a professional athlete, I'm here to do my job. I have my process I roll through, and it doesn't matter. Can't shake me.
Thank you.
Perfect, thank you. And we've just got one more question to finish off with here. So we've had a question: how long do muscle adaptations last, i.e. hypertrophy training for 3 months followed by 3 months of sport-specific training? Will muscle mass reduce when hypertrophy training is swapped with more sport-specific plyometrics for the same sort of time period?
I'll jump in on this quickly because it's the bane of my life. So I have a kind of unique sport in that we have big off seasons. Not many sports get 3 months to do hypertrophy. So we have big off seasons and big on seasons. If you look at hypertrophy, you can put on lean body mass in a very classic hypertrophy way, but strength training still can develop hypertrophy. And what you're normally looking at is a nutritional deficit. So if you are still training sport specifically with plyometrics and strength training, you should be able to maintain that lean body mass. What actually one of the biggest problems I've seen with skiers and snowboarders is they go away and their calorific expenditure goes up. They deal with being at altitude, which increases your basic metabolic rate, and they also don't eat on snow. So in team sports, we will bring on food, we'll have halftime, we'll have water. One of the highest performance predictors is not eating and not drinking on the mountain. So when I first started with the program, the guys would put weight on, get more powerful, ski better, and by the end of the season, they were like this. So that's one of the things that we looked at was you can maintain your lean body mass through the whole season. We do it with our skiers who don't lift a lot throughout the season. They lift hardly anything. How do you do that? It's positive caloric balance, positive nutritional intake, minimum dose to maintain it. So those gains can stay there. They may drop off a little bit depending on the camp or whether they get a week wrong. But I think tracking and monitoring that sits in place, and strength and plyometrics can also keep those hormonal and neural stimuluses going. I don't know if
we look at the drivers of hypertrophy in terms of mechanical stress, metabolic stress, and muscular damage, then they can all be maintained. And as you said, Robert, just from a minimal dose response, are just ticking along nicely in the background. And let's go some lower body hypertrophy work in whatever sport they worked in, as Damian will know, like loads of eccentric deceleration and loads of high velocity running is going to be a great enough stimulus for that to be maintained, and understanding those pathways that are occurring through our sport and our training.
I definitely think as well, just monitoring it. I mean, there is different variances between different athletes, but if you don't monitor it, you don't monitor the load, you can't tell, and the nutritional aspect of it, you can't tell why it's happening.
Brilliant, thank you.
Yeah, so that's it for the questions for now, just because we've met our hour there. So I just wanted to say a massive thank you to each and every one of you. You've been absolutely fantastic, and as I said, some brilliant discussions going on there. So with regards to our attendees this evening, just a reminder that you will be receiving an email after the webinar, and we will be asking for you to provide us with some feedback, which is really important for us because, as you know, this is the first of our webinar series, and we want to make future webinars what you want really, and we want to provide you with some great CPD to implement into your practice. So once you complete the questionnaire as well, you will be automatically directed to your attendance certificate, which you can save and print for your CPD portfolios. And with regards to the question and answers, I'm aware we didn't get through them all. So what we'll do, we'll have a quick look at them and we'll compile them into a Q&A, and we'll get those sent out to all of the attendees so that you can just have a quick look and reflect upon them. But once again, just thank you to everybody. And that's it. Thank you for joining us, and I'm sure we'll see you soon for our next one. Thank you, everybody. Good evening. Take care.
Thank you.